I feel like this is very disingenuous coming from Dr. K, but it literally goes against medical ethics. It's a very, very problematic statement, especially coming from someone who's has an important position in healthcare. Really, that's a really big criticism of what he does. Yes. Very well.
What constitutes a pizza? Is it just someone saying, hey, this is a pizza? No. So
and he said we weren't going to go into philosophy. What constitutes a pizza? What is the ideal form of the pizza? This is another one of those things where people are pissed at him. He actually diagnosed Reckful on stream, live. He told him, no, you're not depressed.
So Reckful, I'm not counting on them to spend 2 years with you.
So what are you counting on?
I'm counting on myself.
I want to watch Dr. K's rebuttal or response to the criticism he's been getting. And this is a recent video, 2 days ago. It's obviously going to be about the stuff we watched a week ago, 2 weeks ago. So let's see what it's got to say.
There have been several concerns in the community, a lot of questions about whether what we do at Healthy Gamer on stream is therapy, whether what we sort of do at Healthy Gamer as a whole is ethical. And I'd love to sort of talk y'all through the ethics of what we do. The first thing that I kind of want to acknowledge is that most people don't really get an opportunity, even in higher education, to really understand or learn about medical ethics. Medical ethics aren't really a matter of philosophy or even opinion. So just because I believe what we do is ethical doesn't actually make it ethical. If someone else believes what we do is unethical, that doesn't actually make it unethical. The truth is that medical ethics are...
Okay, I already disagree. You can't talk ethics without talking philosophy. I mean... just because it's a field that's well-defined and implemented in the current state of affairs doesn't mean that there's no that you can't argue and debate over it, that there's never going to be any changes to it, that there's never going to be future argumentation, or like this is actually very I feel like this is very disingenuous coming from Dr. K.
Are actually very, very clearly defined. There are standards of practice that are actually codified in state, federal, and international laws. And licensing boards are very specific about what is ethical and what is not ethical. So ethics aren't really a matter of opinion. So what are some of the central principles of medical ethics?
Well, yes, but actually no.
The first principle is beneficence. So this is essentially to try to maximize the good that we do. The second principle of medical ethics is non-malfeasance. So this is to try to minimize the harm that we do. The third principle of ethics is autonomy. So this is sort of when doctors, we provide information to people, but it is ultimately their choice whether they engage in something or not engage in something. As a patient, you have the right to refuse a treatment, right? So doctors can't make decisions for you. And the fourth major principle of medical...
Dr. K confirmed anti-vaxxer. You heard it. You heard it from his video first. Sorry, I'm not going to troll. So we have beneficence. I'm going to take notes, you know. The obligation of physician to act for the benefit of the patient and supports a number of moral rules to protect and defend the right of others, prevent harm, remove conditions that will cause... Okay. So beneficence means acting for the benefit of the patient.
This is essentially to try to maximize the good that we do. The second principle of medical ethics is
do not harm the patient. Okay, this is probably the one where most people are gonna... this is the one that most people attack Dr. K on, the maleficence. When the people say that Dr. K has been reckless, that the arguments reside around him harming the patients and the people he's interacting with.
Malfeasance. So this is to try to minimize the harm that we do. The third principle of ethics is autonomy. So this is sort of when doctors...
Oh yeah, and autonomy. So anti-vaxxers, I'm sorry. Autonomy. This one's pretty straightforward. Self-determining your body and shit.
We provide information to people, but it is ultimately their choice whether they engage in something or not engage in something. As a patient, you have the right to refuse a treatment, right? So doctors can't make decisions for you. And the fourth major principle of medical ethics is justice. And that's where we try to deliver medical services in a fair way. So if you kind of think about these principles of medical ethics, it kind of like, it sort of boils down to a lot of what you see in clinical practice. So if I'm trying to prescribe a medication, for example, the medication is going to have some benefits and it's going to have some side effects. So how do I decide whether it's appropriate to prescribe a medication or not? So what I do is I'll weigh beneficence against non-malfeasance. Does the clinical benefit from the medication outweigh the side effects or the harm that it does? If the answer is yes, then it's sort of a good treatment to recommend. I also, as a doctor, allow people to make their own.
So this is generally the decision that has to be made in every single prescription that any doctor does in any situation. It's weighing the entertain me, bro. Ryan's delusions of side pressure grandeur. That's a sick name, Ryan. Or Ryan's delusion, sorry. I didn't want to confuse the two. The entertainment here is we're delving into some drama. I don't know if you're aware of you're familiar with Dr.K or Healthy Gamer GG. I went over a lot of videos criticizing what he's done. And now I'm listening kind of his response to the criticism that's accumulated over the past couple of weeks. This is a bit of a react stream, so we can chat and stuff, but it's not like directly entertaining if you get the gist of my jib.
Own decisions, right? So we're seeing a lot of this right now in the world with people refusing vaccination, where people are allowed to make their own decisions about COVID-19 treatment, receiving it, not receiving it, and that's a central principle of medical ethics. The last principle of justice is essentially that we as doctors don't discriminate. We try to treat everyone the same. And it sort of doesn't matter that you've smoked for 50 years. When you get lung cancer, we're going to treat you the same as if you've never smoked a single cigarette. So these are some of the core principles of medical ethics. And what this
last argument is really important for me. Where I live in France, recently there's been a lot of shit posting in media about how I think the specific person is the director of the hospitals in Paris, who's been fighting for being allowed to not treat or not cover with social security, not covering the treatment of unvaccinated people, which just directly goes against medical ethics. And I'm not an anti-vaxxer. I think everyone should get fucking vaxxed, but it literally goes against medical ethics. It's a very, very problematic statement, especially coming from someone has an important position in healthcare, in providing healthcare. Anyways.
Dive into next, which is a really, really big question in our community, is what we do therapy on stream. So a lot of people will sort of look at what we do on stream and sort of assume that this is the practice of therapy. After all, I'm a therapist and I'm talking to.
Yes, I've been looking into the situation. I'm super interested in how this whole cyber psych thing is going to go out. Is going to play out. Yeah, I'm curious as well. On the one hand, I personally, where I'm at right now, and I'm going to listen to what Dr. K has to say. Where I'm at right now is that I do believe what Dr. K was trying to do was a positive thing to destigmatize mental health, to bring it to the forefront for a younger generation. For people who are more isolated, spending all their time on Twitch, spending all their time playing video games. Not everyone, but I've been there. I'm sure a lot of people have been there. But on the other hand, the whole doing therapy in public thing it goes against everything that I understand about psychology. You should not have people bare their hearts out in public. And you yourself, as a mental health professional, should not trust that they will actually show themselves as the way they really are in public. Rock's bad and Skelly level is better than summon quality. Okay.
Someone about their emotions. So is that actually therapy? And I'd like to start by sort of sharing a little bit of a narrative. So when I started Healthy Gamer, the reason that I started Healthy Gamer is I was working with a lot of people who were sort of the digital generation. And the more gamers that I worked with, the more young people I worked with, I noticed I was having the same conversation
Oh,
over
rocks
and
and
over.
mountains not need non-necro.
In fact,
Okay.
what I noticed was that what was really missing is not clinical treatment.
That's
These were not
resources.
people who needed prescriptions or even psychotherapy. What they needed first and foremost was education. I found myself having the same conversation over and over again, teaching the same things over and over again. So I started to wonder, could I actually help 10 people or 100 people by having a single conversation online? And so as I started to investigate
don't have
that
River yet.
question, even before I started streaming at all, the first thing that I looked into is whether it was possible as a psychiatrist to have public conversations with people about their mind and mental health. The answer that I discovered was yes, you can, provided you do it in a very specific way. So people may think that what I do on stream is therapy, but the truth is it is actually very clearly not therapy. And what do I mean by that? Let's explore that for a second. So the first thing to understand is that the practice of psychotherapy is very tightly regulated. So I can't just, I can because I'm a psychiatrist, but the average person can't just open up an office and say, I'm doing psychotherapy. In the same way that someone can't open an office and say, I'm doing surgery. So there are some things, psychotherapy is a very restricted practice. And so as a result, it's very clearly defined. So what constitutes psychotherapy and what doesn't constitute psychotherapy? The other thing to understand is that therapists are regulated in all manner of ways. So for example, if you go see a therapist, they are not allowed to divulge anything about you, including your name or what's going on with you with anyone else. So when you see a therapist, you are entitled to doctor-patient confidentiality. So what I discovered as I was looking into whether it's possible for me to have conversations online is that what's actually regulated is not necessarily the practice of therapy. I mean, it is, but that's actually regulated under a broader set of ethical and legal guidelines, which is the clinical practice of medicine. So why is your therapist entitled, or why are you entitled to doctor-patient confidentiality with your therapist? It's because they're practicing clinical medicine. Why do we regulate who is allowed to do therapy and who is not allowed to do therapy? It's because we regulate the practice of clinical medicine. We regulate who can do therapy.
So this would be a much better argument if there weren't all those testimonials of actual practicing therapists and psychologists who went over his public online sessions with people and were like, no, this is clearly crossing the boundaries of therapy. You can't appeal to the fact that we don't understand what therapy is when actual fellow professionals in the same field as him have looked at the same information and denounced it. Look, it's regulated, and according to the regulation, it's not therapy, so it's not therapy, and I'm clean, smile. Yeah, well, yeah, especially since, like, so we wait for the investigation then to come out, when the investigation from the board, from the local therapist board or whatever, which I'm fine with, but yeah, this is not a very good argument in this situation.
We regulate who can pull teeth. We regulate who can do surgery. We regulate who can prescribe medication. So all of these regulations are shared, right? So you have doctor-patient confidentiality with dentists, with therapists, with psychiatrists, with surgeons, with endocrinologists or obstetricians or gynecologists. So the ethical guidelines and the regulations of what therapy is and what constitutes therapy falls under the broader practice of clinical medicine. And this is another really important point because my professional training is as an MD. So the laws and ethics that I'm held to as a medical doctor sort of involve the practice of clinical medicine. So what actually constitutes the practice of medicine? So the American Psychiatric Association defines psychiatry as the branch of medicine that's focused on the diagnosis, treatment, and prevention of mental, emotional, and behavioral disorders. So clinical medicine is essentially, it's very specific, but clinical medicine is the practice of medicine. And the practice of medicine is actually very clearly defined. There's a clear line between what is medicine and what is not medicine. So for example, prescribing medications or doing surgery fall under the practice of medicine. Psychotherapy falls under the practice of medicine. And while the practices of medicine may vary a little bit from state to state, each state has its own guidelines, each country has its own guidelines. There are three incredibly common and conserved things no matter where you look at the practice of medicine. Those three things are, first of all, the formation of a doctor-patient relationship. The second is diagnosis, and the third is treatment. So wherever you go, medicine constitutes these three things. So let's start with the first one, the commencement of a doctor-patient relationship. So I know this sounds kind of weird and it may sound kind of simple, but this is actually very, very clearly defined. So the AMA actually clearly defines what constitutes entering into a doctor-patient relationship. And the key thing here is that there's a voluntary agreement by both parties that we are entering into a doctor-patient relationship.
This is, I don't know if Dr. K realizes, this is actually one of the main arguments against what he's doing. If what he's doing after inviting someone on his stream if what he's doing after inviting someone on his stream is therapy, then him engaging in a doctor-patient relationship without going through the proper channels is a huge problem in how he operates. That's a perfectly valid. That's a really big criticism of what he does. This is not an excuse. This is like saying, well, look. Let me find an analogy for this. This is like saying, well, to take money from the bank, I need to have a bank account with money in it. So when I go rob a bank, I'm not actually robbing a bank, because to take money from the bank, I need to have a proper bank account, and it's my money. You're still robbing a bank.
This may sound a little bit weird, but just think about it kind of logically, right? So you can't walk up to me or any other doctor and say, hey, you're my doctor now. Similarly, I as a doctor cannot walk up to a random person on the street and say, hey, I'm your doctor now. The patient has to agree to be a patient, and the doctor has to agree to be their doctor.
The question I have is, why did he even respond? Nothing to gain and a lot to lose by bringing this to light. I think he genuinely feels bad. MrGirl vid got popular, but not destructive popular. He can still farm his brain-dead viewers. Narcissism, and I'm serious. I don't know. I'm gonna say I don't want to armchair psychoanalyze him. I'll just say I don't know. Maybe it's that, but it's also it doesn't have to be narcissism. He could just be genuinely feel threatened and want to well, argue online about this. Also, to be fair, considering that he's not just he's not just a mental health professional, right? He's also an influencer. Where's the video? 114K views in 2 days. Maybe that's also what he's looking after in this. I don't know. But I would like to assume. I generally try to assume the people are what they are until they give proof to the contrary. So I'm gonna give him the benefit of the doubt, as far as assuming he's being malicious in his response. I mean, I agree. Honestly, the best way to deal with this drama was to respond a little bit, but he's going full into it. The initial response was okay and just left it at that. I think he responds because he honestly just cares himself. Yeah, absolutely. Absolutely. He feels attacked, and he is being attacked. And he wants to defend himself. He wants to feel like he's responding. If anything, if the videos we've seen of him talking with Rekful, if anything, that if they've shown anything, that is that he actually is a very emotional person. He's not the kind of therapist who's yes, very well. He's really emotionally involving himself in all his discussions. So yeah, he obviously feels emotionally invested in this too. But then I said I wasn't going to armchair psychoanalyze him, and I just did it. Yeah, but yeah. I disagree with your assessment of the Reckful videos. I think that's one of the valid criticisms against him. He was too emotional in the Reckful videos. He was too emotional, if anything. 33% like ratio. I know.
The American Medical
We're farming
Association
dislikes now.
also clearly defines the exceptions to this rule. So one exception, for example, is emergency care or the case of a surrogate. So if someone is in a car accident and they have a skull fracture or not conscious, they do not have to agree to be a patient. A doctor can actually start administering medical care in the case of an emergency. Surrogates are other examples. So if you have something like a 6-month-old child, the child can't enter into a doctor-patient relationship. If you have someone who's 85 years old and has dementia, they may not be able to enter into a doctor-patient relationship. So a surrogate can enter into the relationship for you. The other major exception to entry into a doctor-patient relationship is a limited doctor-patient relationship in the case of like a consultation or temporary medical care. So I'll give you all just a simple example of this. So let's say I go on vacation. So I have my patients that I'm responsible for. I have a doctor who's covering for me, but that doctor is only responsible for those patients while I am on vacation. And once I come back, that person's limited relationship with patients ends. So all of my patients can't sort of automatically switch over to the new doctor without that doctor's consent. So there are other cases where there are limited doctor-patient relationships. Those tend to be informal consultations. So sometimes, for example, if you've got cancer, you may seek a second opinion from a different doctor. And you still have your primary doctor, but you're allowed to engage in a limited doctor-patient relationship with a separate doctor as part of a consultation. The key thing here is that a doctor-patient relationship is very clearly defined. It's a voluntary commitment by both parties. The other key thing is that the exceptions to the doctor-patient relationship are also clearly defined. There are two major exceptions which we just talked about, and those are the only ones. Talking to a psychiatrist online is not an exception to the voluntary entry of a doctor-patient relationship. The other things, in addition to the voluntary consensual entry into a doctor-patient relationship, are diagnosis and treatment. These are the other two pillars of the practice of medicine. So what constitutes diagnosis and what constitutes treatment? This is where standard of care enters the picture. So we all recognize that, diagnosis and treatment are not the same for any given illness. So diagnosis and treatment of cancer may be different from diagnosis and treatment of, let's say, a physical therapy, like a muscle strain, which may be different from, let's say, diagnosing depression. So there are individual standards of care depending on what kind of medicine you're practicing. And the reason that we use standard of care is to sort of regulate and help all doctors and patients understand what is the responsibility of a doctor. In order to be saying, I am practicing medicine, what are the things that I'm required to do? When a patient comes to a doctor and wants to receive medical care, what is the standard of care that they should provide? So understanding this is also really useful if we kind of like use an analogy. So let's say I go and order a pizza. What constitutes a pizza? Is it just someone saying, hey, this is a pizza? No. So
he said we weren't going to go into philosophy. What constitutes a pizza? What is the ideal form of the pizza? To be honest, the diagnosis shopping can be bad. Like, find a therapist until you hear the diagnosis you want to hear. These people, absolutely, these people do exist. And this is another one of those things where I feel like he's yakshima shake, I feel like Dr. K is sticking his foot in his mouth again in this argument. He literally diagnosed Reckful. This is another one of those things where people are pissed at him. He actually diagnosed Reckful on stream, live. He told him, no, you're not depressed. Yeah, he diagnosed him first session. So like talking about the proper protocol for diagnosis is another big L for Dr. K here.
Think of a pizza as like a couple of core things, right? So there's some kind of like bread or pizza dough, right? There's some kind of sauce and there's some kind of cheese. So the way that we define pizza is based on these three requirements, right? It's got to have bread, it's got to have sauce, it's got to have cheese. Now, I recognize that there may be some different definitions of pizza. I'm just sort of using that as an analogy. And if we look at the practice of clinical medicine across state lines, across different countries, it sort of constitutes three things: the entry of a doctor-patient relationship, diagnosis, and treatment. So then the question becomes, what constitutes diagnosis? What's the standard of care of diagnosis? If I want to diagnose someone, does that just mean like going up to a mental health professional and they just say, I think you have depression, therefore you have depression? Actually, not at all. So there are very, very strict standards of diagnosis. So I'll give you guys sort of a quick overview of what I do in my clinical practice and basically what other therapists should be doing as well, because it's the standard of care. So the diagnostic process involves a lot of different stuff. So it involves taking a history of present illness, which includes like a symptom assessment. So what are the things that you're experiencing? It includes things like duration, frequency, severity of symptoms. So how long have you been experiencing this? You know, how often does it happen? How bad is it? What are the character of the symptoms you experience? In addition to the HPI, we also assess medical history. So do you have any other medical conditions? Have you had any other psychiatric conditions? Have you ever been hospitalized? Have you ever had surgery before? So there are lots of different things that you collect for the medical history. The next thing that we sort of collect is we'll collect things like substance use history. So do you use substances? We'll ask questions about your social history. So where do you live? What do you do? Are you sexually active? What are your relationships like? Is there any chance you have an STI? And yes, I do ask each and every one of my patients, whether they're 13 years old or 85 years old, about their sexual history, because it's standard of care for physicians. Other things include family history. So has anyone in your family ever been hospitalized?
Once again, I wonder what the fuck is he actually working towards a point here? Because once again, this is one of the main criticisms of the whole Dr.K Reckful debacle. He was criticized for diagnosing Reckful on the first session without doing any of this stuff. So you're literally fueling the fire against you by saying this.
Does anyone in your family have medical conditions?
Let's see if he actually
and may sort of recognize this kind of stuff, because if you go to a doctor's office, they're going to give you a bunch of forms that you fill out. And we don't ask any of those questions on stream, right? So people may volunteer some information kind of from a narrative perspective about what their upbringing was like, but we do not do diagnostic assessments on stream. Other parts of the diagnostic assessment include laboratory testing and imaging. Sometimes I'll order MRIs of the brain. Sometimes I'll order lab tests. So the process of diagnosis is actually very, very specific. It's not something that, it's not just like you ask a couple of questions and then you sort of suddenly have a diagnosis. The other thing to consider about the diagnostic process, which is standard of care, is also a differential diagnosis. So it is actually not enough for me to ask all of those questions. As a doctor, the practice of medicine constitutes developing a differential diagnosis. So if someone comes in with symptoms of depression, I also have to assess them for bipolar disorder. I also have to assess them for schizoaffective disorder. I also have to assess them for a substance-induced mood disorder, which in the practice of medicine, we absolutely do. So what I'm going to do, just to show y'all, is take a quick look at the diagnostic criteria for major depressive disorder. So as we can see, the interview should establish the presence of depressive symptoms, depressed mood most of the day, loss of interest or pleasure in most or all activities, insomnia, hypersomnia, significant weight loss or weight gain, psychomotor retardation or agitation, fatigue or low energy, decreased ability to concentrate, think, or make decisions, thoughts of worthlessness or excessive or inappropriate guilt, recurrent thoughts of death or suicidal ideation or a suicide attempt. Depressed mood that occurs most of the day, more days than not, and is persistent and lasts for at least 2 weeks. We also have to go on, so that it just keeps going, right? So we have to determine the chronology of the current depressive symptoms, any prior history of depressive episodes, determine the impact of the depressive episode, elicit alleviating and aggravating factors, and address comorbidities. Include questions about a past history of mania or hypomania. So this is actually the standard that we're talking about. And like, I don't know how else to say this, but we don't do that on stream because that's what constitutes the practice of medicine. Remember, once again, if we're doing therapy on stream, then we have to adhere to the standards of therapy. How do we define therapy? It's part of the practice of medicine. What is the practice of medicine?
I don't believe he diagnosed him. He did say that Reckful didn't seem like he was describing depression, and he may also have depression, but he was describing lack of purpose. I have to pull up the clip exactly. He doesn't phrase. I'll grant you this. He doesn't phrase it in a 100% definitive way, but he does tell Reckful that he doesn't think what he's describing as depression, and he mentions he does talk about bipolar disorder. In fact, one of the interactions that are very criticized was later on. I think it was like third or fourth session. I don't remember exactly. Dr.K told Reckful that people with BPD could be cured of their BPD if they have a consistent relationship for 2 years, and then Dr.K promises Reckful that he'll be there for him for 2 years. And then the next session, Dr. K acknowledges that he was under the influence of emotions. He said things he shouldn't have said, and he walks it back. But like he's obviously still on this idea that that he diagnosed Reckful with BPD. Basically, I felt like that was pretty clear. Now, one thing that Dr. K might be implying in this video is that his diagnosis was based.
Intelligence.
Hey, thanks for the follow break conference.
Supposed to suffocate and pull apart my enemy's arguments.
One thing that I'll acknowledge is that perhaps Dr. K is implying that he made his diagnosis on the basis of information that was available outside of the public sessions of the streamed sessions. In which is a more conducive context for actual therapy if they're done in private, obviously. I agree that he hints at BPD, but he doesn't outright say. I'm pretty sure he explicitly says it. The issue here is that he is an authority on the topic, and him saying you probably have X is something that's problematic. It's not a diagnosis, but if a plumber says you probably have X, I'm 100% like, yeah. Like people have pointed out also, he presents himself as Dr. K, not Mr. K. Whether he gives himself plausible deniability or not doesn't change the fact that what he will be saying has more weight because of the title, the training, the context, the knowledge of him being a mental health professional. And he doesn't really do anything to lower that, really. On the contrary, he plays it up. Yeah, I agree with you, Chinchilla. There are two things that come together, making it at least look like a diagnosis. Yeah, and I can't find the clip like right now, but I'm pretty sure he exactly says he doesn't say like I diagnose you with bipolar disorder, but he does say I think you have bipolar disorder, and he like explicitly says the name, or I think you might have. It definitely is in a gray area. Yes, at best. 100%.
These are the standards of care in terms of diagnosing someone with major depressive disorder. And the simple fact is that we don't do any of that, right? I don't do thorough symptomatic assessments. I don't assess frequency, severity, duration.
That's exactly what people are criticizing you for. That's what I've been saying for the past, past 5 interventions. It's exactly what people are criticizing them for.
Some of these things may come up in the course of stream, but that is not actually constituting a diagnosis. The next thing that I want to point out is for people who think, okay, do I diagnose things on stream? I don't. And so let me actually show you. So someone talking about their depression does not actually constitute diagnosis. Here are what actual diagnoses are. So this is from the ICD-11. So this is the International Classification of Disease. So this is an international consensus about what constitutes diagnosis. So when I'm seeing a patient in my office, I will actually diagnose them with one of these things: recurrent depressive disorder, current episode mild, or current episode moderate without psychosis.
He doesn't explicitly say that Reckful has BPD. He phrased it in a way that made it not a definitive statement. Yeah, yes, that's what I remember as well. Also, BPD is borderline personality disorder, not bipolar disorder. Yeah, you're right. Sorry. Yeah, I'm using the wrong acronym. But he does talk about bipolar disorder. Oh god, I can't find anything right now. I'm sorry. Yes, it is in MrGirl's video. Okay, yeah, then we can have the exact quote. But yes, 100%. He doesn't say it as a definitive statement, but there is a fair argument that even when he couches when he puts it in non-definitive terms, it still has the weight of diagnosis. Especially when you see further clips, the way Reckful talks about it, the way Dr. K talks about it, it's assumed to be a diagnosis. But yeah, and sorry about the. You're right about the BPD is borderline personality disorder. I got my acronyms mixed up.
Psychotic symptoms, with psychotic symptoms, severe with psychotic symptoms, in partial remission, in full remission. These are actual diagnoses. We do not tell people on stream that they have these. We do not ask diagnostic questions to the extent of what is necessary for major depressive disorder. So depression is not a diagnosis. Anxiety is not a diagnosis. Anxiety is an emotion. The actual diagnoses are things like generalized anxiety disorder, socialized anxiety disorder induced by a substance, unspecified anxiety disorder. Those are actually diagnoses, and we do not assign those labels to anyone on stream. What about treatment? So treatment is also something where it involves a standard of care. So the standard of care for psychotherapy, because a lot of people are wondering whether what I do on stream is psychotherapy or not. Let's talk about what constitutes the standard of care of psychotherapy. So when a therapist is
sorry, I think his contention is that he isn't going down the checklist and fully diagnosing. He may talk to them about symptoms. I think the problem is that his interviews may not understand it fully. Yes, 100%. That's why I feel like I understand, and I probably agree with you that that's what he's trying to do here. But I feel like he doesn't realize that this is also exactly what people are criticizing him for the most part, is that it's maybe clear in his mind, but it's not clear neither to the viewers and probably not to the people he's talking to, right?
So I think this is a really common misconception. I think you may have clinical depression, but I think what you're describing is not clinical depression. So I'm going to explain to you guys what clinical depression is. I think your problem is that your life is empty. That's different. And in fact, that's what we were going to talk to the other person about today, and we will. So I got a bunch of questions about this because...
Wait, so you're saying you think I was diagnosed incorrectly when they said I have bipolar?
You may have depression on top of that. But what I want you to understand is that, like, there are different flavors of depression. One of them is a biological, organic, neurochemical kind of thing. And what I'm hearing from, but there are certain features of that you don't really fit that bill. So I'm going to describe what that is. So you may be depressed on top of being unhappy or having a life without purpose. But those are two independent things. So tell me a little bit about, so it doesn't sound like, I'm not hearing anything.
Okay, shit. I was completely wrong. I'm sorry. I retract everything I said. Wait, because he doesn't talk about bipolar disorder here. He talks about depression, or unless I'm missing another part of the discussion. Yeah, I agree. By telling Reckful that he thought he probably had bipolar disorder, he basically did the functional equivalent of diagnosing him. Yeah, but wait, I completely misremembered the quote, because Reckful does bring up he tries to cut in, but he's cut off by Dr. K there. He starts saying like, but what about bipolar? And then he's cut off. I wonder if I go backwards, is there like another part of it, or... I'm confused now. He talks about it in another clip. I can't remember specifically where. There's another part with bipolar disorder in a different interview. Okay. It's one of the last ones. Oh, okay. That would explain...
doing anything.
Okay, so I didn't hallucinate it, right? I'm worried now. I don't want to spread fake news.
See a purpose of getting out of bed. I don't care if I stream or don't, or if I go eat or don't.
Yeah,
at some point I get really hungry and I'm like, okay, I guess I have, like, I feel like it forces me to, kind of, you know?
Yeah.
But I don't really care one way or the other. And then I start to think I don't care if I when I go to sleep, I don't care if I wake up. I'd prefer not to. Actually, the sleeping was the most peaceful part of my day.
Okay. And how long would this stretch last?
Years.
With
Fuck. I watched it last week, and I must not been paying attention like to this, what he's specifically saying. Holy shit! I've had that in my life so much. Exactly what Redfall is describing. This hits right in the feels.
Okay. So I think this is a
okay.
really common misconception. I think you may have clinical depression, but I think what you're
3350. Okay.
To those people.
I'm going to talk to you about something called borderline personality disorder.
Oh, no, it's
I don't think
borderline
you have
personality
this, by the
disorder.
way, and it's not
Really?
my place to diagnose.
Okay,
it.
a lot of
So it
people
is
think I do
BPD.
have that.
Maybe you do. I don't know. So I don't
My
have enough
chat. I'm not-
diagnostic
Yeah, I don't know.
border disorder. I don't think you have this, by the way, and it's not my
Really?
place to diagnose.
Okay,
it.
a lot of people think I do have that.
Maybe you do. I don't know. So I don't
My
have enough
chat. I'm not-
diagnostic.
Yeah, I don't know.
So I'm going to
anything.
just talk a little bit about borderline personality disorder because I think that there's some features of it which are relevant,
Yeah.
and also like some very interesting data that some people don't know. So the first is that borderline.
Wait, so he says he doesn't think he has it. He does clearly say this is not a diagnostic, but he still finds it important to say he doesn't think he has it.
Personality disorder, a lot of times these people have a fear of abandonment, and so they do get overly clingy, and as they get overly clingy they sort of like force people away, and then it kind of like reinforces their fear that like they're unlovable.
Yeah.
And then that sort of, and each round makes it worse because once you do it to the first person, your sense of being unlovable increases, and then when you interact with the next human being, like that wolf has become hungrier, and so when they sort of treat you well,
There are two wolves inside you. One of them's borderline personality disorder, and he's really fucking hungry. Okay. But I also think the reason why we take issue with Dr.K is also because the area he's giving advice on, like the stock guy does day trading on stream, talks about trading, earns his money with trading, but not financial advice guys, by the way. Like the stock guy can be called questionable, but when we talk about mental health, it's more problematic. Absolutely, yes. There is a higher standard for mental professionals, a higher ethical standard for mental professionals than for almost any other field. It's that's just something we as a society have collectively agreed on. I believe he feels he's educating the audience and interviewee about different disorders. Probably, yeah. And this is I misremembered this.
they feel really good about
this
themselves,
discussion.
and when the person starts to like kind of slip away, it gets like stronger and stronger and stronger, and each round is
What is this Dr. K controversy about? People, I would say like spearheaded by MrGirl, have been bringing up a lot of the same criticism that Dr. K, that's been brought up about Dr. K after Reckful's suicide. Basically, and also MrGirl promises to have like more criticism of his organization, a future like video about that that we'll watch when it comes out. But so and now there's 2 days ago, Dr. K published a video response to the criticism that was being driven at him. So we're going over his response as well.
like becomes, as you put it, a self-fulfilling prophecy and makes it harder.
Mm-hmm.
Now, what many people don't know about BPD is that BPD, there's actually some very interesting data. So a lot of people think of BPD as being incurable, but there's some really fascinating data that if you can get in a stable relationship for 2 years and have someone not abandon you, then there's a 50% chance your BPD will like actually go away. So it's really fascinating. And I
So
think
it's the opposite of you shouldn't get in a relationship until you're stable on your own.
Yeah, and I think that's what you need. You need someone in your life who's not going to turn away for a period of at least 2 years, and you may be terrified that they'll turn away at 2.5.
Right. I might never get it. I mean, there's no guarantee I will, but I'll look for it, yeah.
Yeah. So sure there is.
I would not say so. There's
only one
I've
way.
gotten in some really unhealthy situations because I'm so desperate for human interaction that I'll have, paid people's rent just so they'd be my roommate. So I'd have someone around, done it a few times. Just a lot of dumb things like that, or try to get them to quit their jobs and like give them a new job that requires less time so I could have a friend. And then obviously I've realized that these things are unhealthy, but I was just in desperate situations where I needed human interaction.
So Reckful, I'm confident okay. I'm confident that there's going to be someone around in your life who will be there for you most of the time when you need them, hopefully, for at least a period of 2 years.
Okay.
How can I be confident in that?
How can you be confident?
Yeah.
Well, you find me stimulating to talk to, and I'm not demanding too much of your time or spamming you with walls of text. And even if I were, you'd feel inclined to answer me because it's you love helping people. it's your passion. So from your perspective, maybe you can feel confident, but then if you put yourself in the shoes of any other human being, I don't know that they'll really spend 2 years with me unless there's.
So Reckful, I'm not counting on them to spend 2 years with you.
What are you counting on?
I'm counting on myself. It's the only
that
thing
you'll
I can
spend
do.
2 years.
This is definitely murky, this part. Yeah, like this is the part I was saying earlier, and this is not me. I'm not misremembering that. In the next session, Dr.K outright admits this was a mistake. He takes it back. He says something like he was being emotional, and this is a mistake. This is like your therapist shouldn't be talking like this, but it's not therapy. Yeah, and even the whole, like, is it the diagnosis? He says he doesn't think Reckful has borderline personality disorder, but then he spends 5 to 10 minutes talking about how you can cure borderline personality disorder, and then he promises Reckful that he'll be there for him to help him cure that aspect of borderline personality disorder, even though earlier he was saying he doesn't think he has borderline personality disorder, but I guess he agrees at least that about the attachment thing. And then there is this yeah, so this I guess this is why my brain associated him like diagnosing Reckful with BPD, and then this here is Brooke linked this to me, a tweet from Reckful 10 days after that discussion, about how he got diagnosed with BPD. Now, was that a diagnosis coming from Dr. K? Was that a diagnosis coming from another professional? Is that or the worst case scenario? Was that that could have been Reckful listening after that session to like what Dr. K told him and being like, okay, yeah, this is a diagnosis. It's very in general, like it's very murky, and you should never get into that situation. But yeah, anyways, I think this whole meme is just an internet witch hunt. It's got a bit of that. If you wanna have a laugh, go look at the like to dislike ratio on my React video to the MrGirl video, where people shit on me for not being like, yeah, Dr. K is the worst person that ever existed. It sounds like a manufactured drama thing about ethics and telehealth. Well, yes and no. Ethics and telehealth is also like you say it as if it was a meme, but it's actually something that we should be feel concerned about. It's pretty important.
working with a patient, what do we expect from them? What can patients expect? And what are what are therapists responsible for delivering? So a good example of the foundation of a psychotherapeutic treatment is something called a treatment plan. So this is a treatment plan that I just kind of wrote up. It's a fake treatment plan. These are the kinds of treatment plans that I develop for my patients. So, they'll have the name, date of birth, things like that, but then it'll have the first diagnosis. And so this is actually what I do in clinical practice. Treatment plans include things like psychopharmacology. Are they taking medicine? Are we doing some kind of evidence-based psychotherapy? What are the goals of the psychotherapy? What other kinds of things are we doing for health and wellness? So for example, sometimes as part of treatment plans, I'll include mindfulness practice. What's the second diagnosis? What's the state of the second diagnosis? What are we doing for it? Okay, this person had an alcohol problem, but I'm currently not prescribing anything. By the way, they benefited from naltrexone in the past. Psychotherapy there can also be psychotherapy for the second diagnosis, and part of the treatment plan is to go to Alcoholics Anonymous. The third diagnosis is going to be PTSD for this person. So there's medications I'm prescribing, but they're also seeing a different therapist for doing a different evidence-based treatment modality. There's also different kinds of peer support, and there's a medical diagnosis thrown in. So this is an example of what an actual treatment plan is like. When you perform therapy with a patient, this is what therapy actually looks like. I'll show you just another sort of generic example of what a treatment plan, this is just something I found on the internet. But once again, this diagnostic system is kind of a little bit outdated. So this is from DSM-4, so we've kind of updated this. But the key thing here is, once again, there's a principal diagnosis. There's a diagnosis that's assigned. There's a duration of diagnosis. There are functional deficits that are mentioned. What's issue number one? What's goal number one? What's objective number one? What's task number one? What's task number two? What's area number two? What's issue number two? What's goal number two? This is what constitutes an actual treatment plan. So when you perform therapy on someone, you're doing all of this stuff, right? So this kind of comes down to, like, do we do therapy on stream? And the answer is absolutely not. And the reason we're able to say that is because therapy is actually very, very tightly regulated, right? It's not a matter of opinion. It's just because Dr. K believes we're not doing therapy doesn't mean that we're not doing therapy. When we set out, we designed stream with these considerations in mind. So when I thought about, okay, what am I allowed to do on stream? What is ethically and legally appropriate to do on stream? The main conclusion is I'm not allowed to practice medicine on stream. Even then, there may be some theoretical situations in which that's possible, but generally speaking, that's the main dividing line. So everything we do on stream is not the practice of clinical medicine. In order to sort of figure out what is okay on stream, we can define what the practice of clinical medicine is, or understand the definition. So that's not something we define. That's something that we exhaustively looked up by looking.
Once again, I feel like Dr. K is misunderstanding the criticism levied at him. Yes, it's what he's doing is not doesn't have all the characteristics of therapy, but it's exactly because it's in a gray area that people feel like what he's doing is unethical. It looks like therapy. It can be misconstrued as therapy, and that makes it problematic. He's not actually addressing the criticisms in what he just described, and that's really annoying to me. I don't know if he actually just misunderstands the criticisms or misunderstands the logic of what's happening, or I feel like there's some kind of misunderstanding here. I don't think it's willful, but there's clearly a misunderstanding. Thank you for hearing out both sides. I'm glad you appreciate it, Sensei Tumbleweed. It's something that I try to do in things. I've noticed not many people appreciated it in my react to the MrGirl video, but it's okay. Like I told my editor, we're farming dislikes now. It's all good. There is some legitimacy to the criticisms being levied at him, but it is extremely unlikely that he'll be punished in any way or lose his license. I don't know enough about the technicalities of medical ethics boards to know, and like precedent in that field to know if he will actually have real life consequences or not. But yeah. But other than that, I agree. Nuance man and added again. If patients didn't commit suicide, then there would be no demand for a therapist. We smart. Yeah. Actually, most people in the US who end their lives have never received any mental health treatment. That makes a lot of sense as well. Yeah. Yeah, that actually makes a lot of sense, right? If you actually are being treated and followed, your morbidity goes down a lot. Not to mention that as well, there's so much more to mental health than just suicidal ideation. Obviously, suicidal ideation is a very well, it ends in death in the worst case. So it's obviously one of the worst things you can think of in as far as mental health goes. But there's so much more to mental health than just that. You can publicly view all of the disciplinary actions taken against doctors, and basically all of them were found guilty of committing a crime. Ooh, yeah. That raises the standard. The required, if that's correct, then that raises the required standard of accusations against Dr. K by a lot, for sure. He may be smartly sidestepping, directly addressing the gray area. He does talk more about this later in this video, about the review boards he talked to before starting his stream. Okay, yeah, let's see. Maybe he addresses it later. That's fair as well. Let's see if he actually does address it. And yeah, you're right. Actually, just from a PR perspective, saying a lot of stuff without ever actually addressing the core issue is not a bad PR strategy. Politicians do that all the time. Like in French, you say noyer le poisson, to drown the fish. So like, or to use like a more English idiom, it would be like hiding the elephant in the room with a bunch of other shit, right? So maybe that's the strategy there. 2021 disciplinary and other board actions. Yeah, I'm sorry. I'm not going to go like in a detailed like legal research mode onto this, but interesting link. It's interesting that it's public. Thank you for the link, Bright Conference.
Looking through, hundreds of pages of medical ethics documents, state laws, federal laws, regulations, licensing board things, ethics, opinions on ethics from the American Medical Association, the American Psychiatric Association. And what we sort of decided to do on stream is actually clearly outside of those things. The other simple gut check that I have for y'all is when you go to a doctor's office, how similar is it to what happens on stream? And the short answer is like not at all, right? Because doctors are practicing clinical medicine. And what we're doing on stream is having conversations about mental health. We do not enter into a doctor-patient relationship. We do not diagnose people with medical illnesses, and we do not treat them for medical illnesses. Psychotherapy is governed and regulated, and the ethical standards around psychotherapists are under the broader umbrella of clinical practice, right? So you are not allowed to engage in a romantic relationship with your doctor. You are not allowed to engage in a romantic relationship with your psychotherapist. You are not allowed to, as a therapist, violate your patient's privacy. The legal protections that we have constitute protections from a doctor-patient relationship. And we don't enter into that, we don't diagnose people, and we don't treat people. So then the next question, very naturally, is why do people think that what we do on stream is therapy, right? So where does this idea come from? What do we actually do on stream? And are there any overlaps with therapy? So it's a really good question because I don't think most people, like we sort of mentioned, most people haven't studied.
You might also want to check out Destiny's upload of a podcastish talk with MrGirl, Dan, and Dr. Avi. You might notice in that while the other people want reformation for Dr. K, MrGirl has a strong motivation to take down this guy for good. He purely believes that Dr. K is a force of evil. Huh. Yeah, I got that impression from the. So I looked a bit at the tweets and stuff like that from MrGirl, and I thought he was just drama, farming it for drama. When MrGirl was using like really inflammatory language in regards to Dr. K, that he was just really pushing up his position for drama. He's a YouTuber, a streamer, an influencer. That is how you do things when you're in that field. That is how you rile people up, right? So, do you think that when he was on that podcast, I would have to watch it and make my own opinion, but do you think when he was on the podcast that he was still doing that, like playing up for attention, for drama, or that he had a genuine personal conviction? Because if he has a genuine personal conviction, then that, I don't know. At the same time, that makes sense, especially if, for example, he has perhaps some personal history, or in his family some personal history with a medical abuse of any form. Then you'd obviously be very sensitive to those kinds of issues. I don't know. Yeah, but the problem is, even look at Dr. K's streaming room. It literally looks like an office. There's a plush sofa behind him. Yeah. Yeah, he needs a real gamer room like I have. Large part of the MrGirl's problem with Dr. K has to do with his coaching business as well. That is true. Yeah, that's something people have brought up multiple times, and we will see about that in the next MrGirl video. MrGirl has promised that his next big video will be a takedown of the Healthy Gamer GG organization, not specifically targeting Dr. K, but the organization itself, using testimonials from people working there for about unethical practices within the organization. So we will see. MrGirl's father and grandfather are psychologists, and he has a bachelor's in psychology. Okay. I really want to take a seat. MrGirl definitely is genuinely emotionally invested in this. He seems to literally believe that Dr. K is a bad and malicious person. Okay. But he also hates his father and grandfather, he has said somewhat recently. Okay, I'm gonna do some armchair psychology, but please, if you have even just an anecdote that goes against that, tell me. I have never met someone in the field of psychology, and I've met many people in the field of psychology. I've never met anyone in the field of psychology who didn't have at the core of their personality or their personal life experience deep-seated issues. Every single person that I've met in the field of that had anything to do with the field of psychology were in some way or other looking to address their own issues through their learning of psychology. It's a very, very common trope, is my understanding in that field. He hates both his parents. They were abusive. Damn, that sucks. He said that, but I watched a video where he said he won't respond to this video, so I'm not sure if there will be any video. Oh, maybe he will not respond to this video. But he did say that he has testimonials from Healthy Gamer GG employees about unethical practices, and that he'll make a video about it. So I don't know. We will see.
Medical ethics. They don't really understand the definition of the practice of medicine. They're not trained in diagnosis. They're not trained in developing treatment plans or doing psychotherapy. So where do they get this idea that what we do on stream is therapy? So it's a really good question. So what we do on stream is we have conversations with people that are about their mental health, and I use some skills. So I'm a very good listener, for example. I'm very good at asking questions. I'm very knowledgeable about things. So I'll build some amount of an alliance with the person that I'm talking to. I'll be a very active listener, and I'll ask very insightful questions. So sometimes people think that that constitutes therapy, whereas no, that doesn't constitute therapy. So I'll just think about this for a second. There are other professions outside of therapists that do these things. So who builds an alliance very quickly with the person that they're talking to? Who makes very empathic statements and tries to help people open up? FBI hostage negotiators, right? Even customer service representatives. If you've been on a to a customer service representative recently, you may have noticed that they do some of the skills that are, generally speaking,
yes, that is what we're all thinking of. MrGirl did say in that podcast that if Dr. K's license was taken away and he stopped breaking laws, he could continue doing what he's doing and he wouldn't care nearly as much. That is a very wait. I would need to. I need to watch that podcast because that to me is a very strange statement. You cannot at the same time argue that that what Dr. K is doing is unethical, and then be like, oh, but if he loses his license, he can keep on doing what he's doing. It's either unethical or it isn't, and obviously obviously there's a higher ethical standard for health practitioners. That is at the core of the criticism, but that's still a pretty weird statement. I would need to like hear the context of it. I believe he has strong conviction in doing this. He lacks any kind of irony or sarcasm throughout the conversation, and you could feel that the 3 other people in the call were subtly making fun of him, despite being also critical of Dr. K. Yeah, I imagine. I can't see, especially Dan. I can't see Dan in the conversation. I used to be a big Destiny watcher, so I know the people you're talking about. I can't see Dan being in a phone call about this drama, being like actually serious about it. If he lost his license, then he would lose his credibility. He built his brand on being a hard psychiatrist. Yeah, that is true. Yeah, no, that is true. That is true. He would lose his credibility, and that would lower the whole ethical ambiguity thing. No, I take back what I said. It still feels like a weird statement. But yeah, no, you're right. I take it back. Edit it out of the video when we publish it.
They'll make like very empathic statements. Oh, I'm so sorry that you had to go through that. So this is like really important to understand, but just because I'm a very good listener and just because I'm very good at like asking questions and making observations and reading body language, that is not what actually constitutes therapy. In fact, these are skills that are used by all kinds of people. So executives, for example, will get like interpersonal training and training in relationships and communication. So these are skills, like communication skills between people, are things that I absolutely do on stream, but I don't do anything medical on stream. And oftentimes, because people don't recognize or understand what constitutes the practice of clinical medicine, which isn't really a problem because you're not going to learn that.
So this bothers me a little bit. Legally speaking, what he's saying is absolutely pertinent.
School.
Oops. Legally speaking, what Dr. K is saying here is 100% relevant to the discussion. But ethically speaking, if you're someone who has read how to like influence and manipulate people, who's really deep into all those concepts of manipulation and understanding how to read people, how to push them one way or the other, I would actually argue that you have a higher moral standard in your interactions with people that you have to uphold. It's basically the concept of power is responsibility at its core. If you have the power to manipulate people, then you also have the responsibility to do it in a constructive and positive way, and to know when to use your power, when not to use it. So him describing someone who's like in marketing, who knows a bunch of psychology concepts and brings them to bear to manipulate people, I'm okay with pushing a higher moral standard onto that person. I'm fully okay with that. I don't think that lowers the moral standard of Dr. K talking with people is the problem. A fellow degenerate. What does monk-ass mean? I keep seeing that everywhere. I have no idea what people are talking about it. Yeah, it's an emote to show fear. If you zoom in on it, the Pepe has like drops of sweat and is like wide-eyed like this, like, you know, scared and shit.
Or you engage in some other kind of clinical education, you know, it can look like what you imagine therapy is. Because what do you imagine therapy is? It's like what you see based on media and TV shows and stuff like that. Whereas the truth is that the practice of clinical medicine is completely different. So there may be like, even though I've sort of made a very strong case, and like I said, we sort of set stream up to be outside the bounds of the practice of clinical medicine and therapy, there still may be some kind of confusion there. So like, what if you kind of make the argument, for example, that even though I'm a medical doctor and I'm not entering into a doctor-patient relationship, I'm not diagnosing anyone with anything, and I'm not providing treatment plans, right? So I'm not doing psychotherapy. I'm not, providing medications or anything like that. I'm still a medical professional who is like listening empathically, which sometimes is done in therapy. So therapists are absolutely empathic listeners. So if I'm a medical doctor, am I allowed to empathically listen to someone and ask someone insightful questions? Or is that something that I'm no longer allowed to do except with my patients? And that's kind of like absurd, because the answer is clearly I'm allowed to do that with people without entering into a doctor-patient relationship. So for example, I do that with my kids. I do that with my wife. I do that with my friends. When human beings talk to me, I try to be an empathic, active listener. When human beings talk to me, I try to ask insightful questions to help them out. If a friend of mine is going through a breakup, I'm going to sort of, listen to them very carefully. I'm going to sort of maybe even get emotional with them. We'll sort of have a good cry together. And then I may sort of ask some questions or volunteer some information or teach them how to meditate. Just because something happens within a therapeutic relationship does not mean that it is therapy when it happens outside of a therapeutic relationship. So just to kind of reiterate that, like, if you really think about it, like, if that were true, if I weren't allowed.
So this is an argument I brought up in that video that a lot of people are fucking hating. In the video that I brought up in the React video that got published on my channel, to the MrGirl, well, I guess attacks on Dr.K. This is something that I brought up as well, that I think is why a lot of the criticisms also will just fall into a gray area. It's not as black and white as some people really want to make it. Yes, you will have discussions about emotions with people, and that's a good thing. You're not supposed to only ever talk about your emotions with therapists ever for the rest of your life, or as a therapist, you're not prohibited from talking about the emotional stuff with people. That still doesn't counteract the fact that Dr. K perhaps does not draw the line clearly enough in his streamed sessions. I think that's a perfectly fair criticism, but there is a bit of pushback to be done there, and I think Dr. K is right in bringing this up.
To have emotional conversations with other people, like I couldn't interact with other human beings in an empathic way. And this is what's sort of brilliant about the way that clinical medicine is defined, because it's defined about what's the goal, right? Is it diagnosis or treatment? If yes, then it's clinical medicine. If no, then it's not clinical medicine. So there are other things besides communication skills which can be, taught as part of clinical medicine or used as part of clinical medicine, but aren't technically clinical medicine. So I'll give you all a couple of examples. So as a physical therapist, if you're a good physical therapist, you'll teach your patients to stretch. Does that mean that stretching is a part of physical therapy? Sort of, but is it exclusive to physical therapy? No. So if you go to a personal trainer who's a non-clinical person, they're allowed to teach people how to stretch as well. Then the next question kind of becomes, is a physical therapist allowed to teach people who are not their patients how to stretch? Absolutely. Right? So if I'm
stretching
a physical
is
therapist
malpractice.
And on weekends, I have a CrossFit group, and at the very beginning of the CrossFit group, I teach people how to stretch. Even though it's a part of my clinical practice that I engage in it, it's not exclusively a clinical activity, so I'm allowed to do it with random people if I want to. Another good example of this is meditation. So meditation is something that's been shown to have a clinical benefit. So as a doctor, I will teach meditation to my patients. Does that mean that if I teach meditation to someone outside of my doctor-patient relationship, that I am their doctor or practicing medicine? Absolutely not. One of my mentors is a Zen priest, and they teach their patients how to meditate. And on the weekends, they go to the Zen temple and they teach.
Okay, this one I'm actually gonna play I'm actually gonna shitpost on this. As someone who grew up in a Buddhist temple, like for most of my life, I have a lot of how to put it. I have a lot of experience with how frowned upon it is to teach Buddhism when you're not qualified for it. a lot of people within the realm of Buddhism, at least when you go outside like the very Western New Agey circles, believe that you shouldn't be teaching Buddhism if you haven't gone through qualifications, transmission from a teacher, years of practice, years of learning, and experience. Not dissimilar to therapy. Anyways.
Students how to meditate. That does not mean just because something can exist within therapy.
You can see it in manhwa too. Yeah, actually you can.
Therapy, like listening well, being a decent human being, and asking good questions makes it the practice of therapy. The last thing that I'll say is that...
Sorry, I'm talking about this because it was a stream from a long time ago, but we actually went over the fact that there is such a thing. Oh god, I'm fucking dying. Oh no, I can revive. There is such a thing as there is such a thing as that's possible as harming yourself through meditation. You can absolutely practice meditation in a way that will harm you. You can absolutely learn things in a way that will harm you. So the Western people who adopted these meditation techniques aren't actually qualified to teach them. Some are. For example, my parents received transmission from someone in direct lineage from the Buddha. So they had the official qualification within the Buddhist religion to teach Buddhism, the philosophy, the teachings, the mythology, and the practice of it. And they were qualified to lead Buddhist communities. Even though they were Western people, they had received direct transmission. I don't want to like say exactly who, because you can actually like fucking dox me with it. And there's actually like my dad's name is like on fucking websites and shit. So if I go too much into detail, you can like transmission and stuff. You can probably like track it down. This is the podcast with the part about him not having his license. Oh, wait, what are you talking about? The MrGirl podcast? Stop! I could already dox you from this info. Probably. I thought we were playing name doxing. Hey, it's not a name on stream if I haven't doxed myself. It's been a while.
This is also very clearly defined. So in the practice of clinical medicine, there are some things that are exclusively clinical medicine, and those are very tightly regulated. And I am not actually allowed to do those things outside of a doctor-patient relationship. So the simple example is like prescribed controlled medication. So prescribing medication is exclusive to the practice of clinical medicine. So I can't prescribe Adderall or opiates to my wife. That is actually considered unethical. I cannot do particular things. I cannot diagnose or treat my wife. I cannot diagnose or treat my friend. In fact, that is a very, very important ethical boundary which we respect at HG. Once we have a relationship with someone that is a non-clinical relationship, we don't cross that line. So this is really, really important to understand because there are some things that therapists may do, but those are not exclusively the practice of medicine. And even as a medical provider, I'm allowed to do those things with like ordinary people without it being the practice of medicine, right? So just like the physical therapist who can teach someone to stretch, just because it's a part of their clinical practice doesn't make it exclusively clinical practice. And there are clear lines about what's exclusively the practice of clinical medicine, and we don't do those things with anyone on stream. So the next thing that I want to talk a little bit about is the actual stream process. So how does someone come on stream? What are the protections that we use? What are the standards that we hold to? And so this is where there's another really important part that I want to talk about, which is kind of an ethical standard that we hold ourselves to, which is informed consent. So before people come on stream, they meet with a producer, and the producer sort of lays out with them what stream is, what's allowed, what's not allowed. We make it very clear to them that this is not the...
Okay, going back to Dr. K kind of putting his foot in the mouth, That's not what happened with Recful. With the Recful exchange, if it's genuine, like the first session at least was very organic, right? It was someone talked like in I don't remember the exact order, but it was something like someone talked in Recful's chat saying, "Hey, you should go talk to this guy. He like talks about therapy on stream." And then someone in Dr.K's chat was like, "Hey, Dr. Recful is checking you out. You guys should talk." And then they like talked. Or maybe there was like some time, and they properly set it up, like what he's talking about. But I thought it went like boom, 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 and boom, they're in like a Discord call together. One question Dr. K does need to answer is, when did he start having a producer? Well, yeah, that's like I think that early on, that's not how he was working. I could be wrong, though. I could totally be wrong.
Practice of medicine, that Dr. K is not your doctor, and we make sure that they agree to that. So we go through an informed consent process.
I think I'm going to die
if there's
here.
any confusion there, or they're
So let's
looking for
just
some kind of
close
medical
up
advice,
this
that's where things
thingy.
end, right? So we inform them, and then we go through the consent process. And this is where the ethical principle of autonomy comes up. So we at HG believe that a human being, an adult, who wants to come onto the internet and voluntarily talk to someone about their mental health should be able to. We believe that human beings should have the autonomy to make their own decisions. So out of respect of that autonomy, we want to make things very crystal clear. So we have conversations with them. We also give them the opportunities to set boundaries on anything that they don't want to talk about. So this is not something where like once they come on stream, they're also allowed to set boundaries in the middle of stream if they want to. But they're allowed to say, hey, I don't want to talk about this on stream. I don't want to mention this.
Recful situation happened and within like 5 minutes from when someone told Recful he should talk to Dr. K. Yeah, that's what I was remembering. Absolutely. So yeah, this what he's talking about right now, it's good that he does this. Sure. But I guess then you can say maybe he learned from his mistakes, if we want to spin it positively. But that then you have to acknowledge that you made those mistakes in the first place. He's like denying that ever happened now, kind of indirectly by saying this.
Stream, I don't want to mention this on stream. So what we said.
Yeah, after Recful, they improved and optimized the program. They started limiting multiple sessions, and if they did do multiple sessions, they would talk different topics on those different meetings. I see. And that's good. They did learn from it, but it's a rough thing because people definitely also want to crucify him for what happened with Recful and blame, and they don't want to. A lot of people don't just want to say that Dr. K was reckless or negligent. A lot of people do think that he actually caused Recful's death, and so it is a hard subject to talk about. But still, if you want to be a responsible person, you acknowledge your mistakes. I 100% believe that, and that's something that he should be doing here. Yeah, they didn't acknowledge their fault after their optimization. Yeah, and you can acknowledge that there were mistakes done without saying that you caused his death. You can admit that there were mistakes. The one caveat to what I'm saying though that I have to concede is that admitting a mistake can be used in court against you. Yeah, I wonder if that could be used against him if he admits it publicly. Absolutely. That's like one of the memes about the fucking about what was happening in what happens with cops in the US, where they like a cop will almost never say sorry for something because that's an admission of fault, legally speaking, that can then be used against them. There's some I don't know if that's true, but that's like some bullshit someone told me once, which reminds me of his own quote: "It's not your fault, but it's your responsibility." Yeah. Recful was doing 2 grams of psilocybin a day in the lead up to his suicide. Think that is a larger comorbidity? Possibly not. That one's a bit of a complex question because So I don't know if 2 grams is microdosing or if it's an actual hallucinogenic dose, but there is an emergent corpus of literature about how certain specific psychedelics actually have very strong therapeutic potential. So that could be a comorbidity. The same way it's very liminal. I thought it was it has real potential, but maybe, yeah. Anyways, what I was gonna say, I don't know, like the antidepressant I'm taking, it actually has in its secondary its side effects, it actually has listed suicidal ideation. It's clearly said that if in the first 2 weeks of taking it or the first month of taking it, I have suicidal ideation, I need to call my psychiatrist and like I need to right away seek help. It's a known side effect, and it's something that does actually happen to with a lot of well, psychoactive stuff. So definitely a possibility. I don't disagree on the benefits, but those studies happen in controlled circumstances, also given his state of mind at the time. Yeah, for sure. Dr. K does talk about Rectful at the end. Okay. That's actually a good argument. HealthyGamer.gg is a well-established company now, and admitting to mistakes as to probably cause someone's death is life-threatening to the business, ironically. Yeah. Yeah, it could be that they personally acknowledge that they did mistakes, but they cannot do it publicly.
Essentially do is go through a rigorous informed consent process where we explain very clearly this is not a doctor-patient relationship, and we make sure that they're on the same page. If there's any confusion there, we either resolve that confusion or we sort of stop, right? Because we are not going to practice clinical medicine on stream. So here at HG, we actually hold ourselves to a very high ethical standard, despite the fact that we are not engaging in clinical activity. So on stream, I don't practice therapy because it's very clearly defined, right? So remember that therapy is part of the subset of the practice of clinical medicine, which is why you get doctor-patient privileges, there are ethical guidelines around your therapist, et cetera, et cetera. And remember that the practice of clinical medicine is clearly defined as having 3 components. The bread is entry into the doctor-patient relationship. That's how it starts. The sauce is diagnosis, and the cheese is treatment. And since we do none of those things, we're not practicing clinical medicine and we're not doing psychotherapy with people on stream. At the same time, we hold ourselves to a couple of really high standards. So the first example that I'll give y'all, and this is in many dimensions of our company and our work, but the first is research. So for example, for all of our research studies, we submit them to something called an independent review board, or an IRB. So there's a third-party organization which is not affiliated with us at all, and when we want to do research, we'll take our research study and we'll pass it to the IRB, and we'll say, hey, we would like to do this research on human subjects. Will you please evaluate it and tell us if it is in alignment with ethical principles? And the IRB is essentially, they were developed kind of after people did predatory research on human subjects. And so we've actually had 5 independent reviews of our research and a 6th that's ongoing for another study that we're doing that have all sort of met an independently reviewed ethical criteria. So we got the green light from an institutional review board, which is a third-party kind of ethical organization that approves the research that we do. So the other thing that we hold ourselves to a high standard to is being responsive to feedback. So here at HG, we're sort of in new territory, right? Mental health is rapidly evolving. The needs of this generation in terms of taking care of their mental health are rapidly evolving. The solutions that we need to use are rapidly evolving. 100 years ago, no one was meditating for the sake of their mental health, but now we have these new tools. We have these new challenges like social media and online toxicity. And so as we sort of adapt to these new circumstances, we don't have all the answers at HG because no one has all the answers. These problems are new. So a big thing that we sort of very, very carefully focus on is taking feedback. And this is something that we actually pride ourselves in. HG has gotten to where we are today because of the feedback from our community. So I'll give you all just one simple example of this. In the past, I had talked a fair amount about Ayurveda. Generally speaking, when I talk about Ayurveda, I talk about it more from a personality analysis standpoint. And as part of the support for Ayurveda, I cited a couple of scientific papers.
Okay, this interests me as well, because the papers he cited, to my knowledge, are pretty clearly debunked. and so I'm very skeptical. We looked a bit into the citations he had for Ayurveda. They're very weak. They seem to come from very biased journals by very biased researchers, and also like once again, like I come from a Buddhist background, etc. I'm super stoked that meditation, for example, is a practice that's acknowledged as having therapeutic benefits. That people in research are generally more open to some like unintuitive or hidden benefits from alternative medicine. That's great, but we kind of debated on stream with a friend of mine a bit about for example, the phrenology in Ayurveda, and it does seem to come from, first off, very cringe historical origins, which is the caste system in India, and the phrenology seems to be have been developed in support of that, and also just generally like fucking phrenology, like there's a different. It's one thing to talk about phenotypes and how they can be indicators of more generally genotypes underlying those phenotypes, etc. That's perfectly appropriate, but there's a complete difference between that and talking about like nose shapes and shit, or like the problem being it takes a lot more for more than just the shape of a nose to be able to make like definitive statements. It starts with every name on skull, very vata, yeah. Main problem being like what Turnit pointed out, a really big issue was the different ethnicities are going to have completely different phenotypes that aren't gonna the Ayurvedic phrenology isn't gonna work for, even if you assume the best case scenario where it actually works for people of Indian ethnicity. So anyways, back to let's see what he says. Take off your glasses, please. I think you're sounding like a vata.
7 months ago, someone in our community made a post sort of questioning the veracity of the research that we were citing. And it turns out that they made really good arguments. So we talked about it on stream, addressed their criticism. Turns out that a lot of their criticisms were actually really good. And for the last 7 months, we haven't said a word about Ayurveda. Internally, we're going through the process of reviewing a whole body of Ayurvedic research. My point here is that sometimes at HG, we'll say particular things that we believe are correct, and we'll even do some research and we'll cite papers and stuff like that. But no scientific paper is perfect. And as members from our community will point out those kinds of things, we will absolutely adjust our behavior. So one of the things that we really value and hold ourselves to a very high standard about is actually accepting feedback from our community, which is really helpful and is actually really responsible for the impact that we've been able to achieve. The last thing that I want to mention is that the work that we do at HG is not in a vacuum. So like I sort of mentioned, before we even showed up on stream, we did a ton of research about what actually constitutes therapy, what actually constitutes the practice of medicine. And based on our research, that is how we decide what to do. As a simple example, the World Health Organization in 2020 released a report which sort of emphasized that mental health is in crisis. And one of the key interventions that they said people need to be doing more peer support, that clinicians are sort of insufficient and we can't train them fast enough to meet the demands of what mental health needs are. So peer support is non-clinical intervention that supports mental health. And so it's because of calls like that that we've developed community support programs. It's because of calls like that that we've even developed our coaching program. So here at HG, what we're doing is not just like what we think is a good idea.
Okay, so this is just good PR, insisting on the fact that regardless of the criticism addressed at him, he's basically saying the benefits outweigh the benefits brought by Healthy Gamer, GG, etc. outweigh any possible criticism. He's not saying that exactly, but that's the point of what he's saying. He's talking about the benefits of what he's doing. That's why he's talking about the mental health crisis. That being a very real thing, and that obviously justifying the existence of his organization and his practices. Yeah. Oh, from Leafly, Medium dose amount, 1.75 grams, you'll likely experience some psychedelic effects, including open and closed eye visuals, synesthesia, blending of the senses, and heavier euphoria. Well, the problem is it depends. It depends on like. It depends on whether it's dried or wet mushrooms, right? If it's wet mushrooms, then or dried mushrooms, it's completely different. But yeah. Yeah, facial shape thing was weird, though his fire, water, earth metaphor made sense for me, at least, even though I'm aware it's pseudoscience. Yeah, I don't mind that as much. People love that's a dried mushrooms. Yeah, but we don't know if what Reckful was taking was dried or wet, right? That was so like when Reckful says he was taking 2 grams. Oh, you're not allowed. Oh yeah, maybe. Yeah, there's also an issue on YouTube. I haven't touched the rules in the chat and stuff, but there are bots that go through YouTube live streams and spam porn links, basically. So I'm pretty sure links are like auto blocked. Yeah, with the fire, water, earth thing, I don't think that's a big deal. People are really sensitive about pseudoscience, but I think it's fair to acknowledge that sometimes pseudoscience in certain forms is not as harmful as you would intuitively think it is. So what I would specifically talk about is placebo effect. Well, obviously the placebo effect is only going to work on things that are tied to our mental state. But for those things, it's a very real effect. It's a very real thing. You can't look at someone suffering from something and be like, you should not take this because it's placebo, even though it's still going to help them. Obviously, if you have a proper medical alternative that actually does treat you beyond placebo, that's better. That's 100% better. You should always go for that. I'm not saying, but sometimes you don't have that alternative, or sometimes you just want to do that thing that's placebo on top of your normal medication. Then there's nothing wrong with that, whether it's acupuncture or massage or whatever the fuck. Those things don't have like explicit studies on their therapeutic benefits. Acupuncture, I saw a study on it. It's basically very it's not placebo, but it's something where like when someone was sticking in the needles who didn't know any acupuncture theory, so they were just like putting them in random places instead of the chi energy points, it had the same effect as the master acupuncturist doing it. And that's like, okay, cool. Like it's funny from us, like, yeah, it's pseudoscience, but who the fuck cares? If it makes you feel good, if you're not destroying your life to pay for acupuncture, it's just like a small extra expense. There's nothing wrong with it. I'll stand by that stance. Anyway, sorry, I went on a rant. I just like learning new things and looking things up. Hells yeah, me too. 100%. Reckful was a proper high from his shroom doses. We know he took 2 grams and had diluted pupils like crazy. So I've had diluted pupils from psychedelics without actually being high, but yeah, that could be that makes it very likely he was taking dried mushrooms then, like a fully psychedelic dose.
Yeah, but we regularly and consistently, since before we even showed up on stream for the first time, have been consulting with industry professionals, psychiatrists, professional organizations, talking to people, for example, like
Mansion right away.
On the Council of Addictions, talking to people at the World Health Organization. We even recently had a collaboration with the United Nations. So what we do at HG, and this is a standard that we hold ourselves to, we recognize that we don't have all the answers. We recognize that like this is a new problem, and that the best way to sort of tackle this problem
Destiny has said he was taking a crazy amount like every day.
Okay. Is to continually engage in dialogue with other professional organizations. So that's what we've done from the get-go. The next thing that I want to talk a little bit about is something that's a little bit more negative, and that's hate farming. So there's been an increasing and disturbing trend on the internet recently of people sort of being increasingly critical and essentially farming hate. And I want to talk a little bit about what we've learned sort of in terms of our platform and sort of the reach that we have and how we try to behave in an ethical manner. So as a content creator, I feel like I have a duty to use my platform for good. The unfortunate thing is that there are some people out there who will use platforms essentially for negative reasons. So they'll hate farm or criticize or things like that. And like I've said, we're actually completely open to criticism, assuming that it's sort of fair and based in fact and is well cited. So we're completely open to criticism and quite responsive to criticism like that. Unfortunately, what we're seeing on the internet is an increasing amount of like toxicity, right? Like we can all feel that the internet is becoming a more toxic place. And so what I'd like to do today is talk a little bit about how I've come to understand hate farming and sort of what goes into it. So the first thing to understand is that hate farmers usually are operating on an emotional level. And the main emotion that they sort of target is a vague sense of righteousness. So when you watch a video by a hate farmer, what you'll often find is that it's
We all know what he's talking about.
Right? So it's going to have very powerful imagery. It may have sort of a very strong title, may have sort of a very powerful thumbnail. And as they sort of as they start to weave their narrative, like what you're going to be feeling is some sense of outrage or irateness or things like that. And the more that hate farmers kind of engage your emotions, right? Because that's what it's about. It's about making you angry. It's about making you grab your pitchfork. Let's all grab our pitchforks and down with the bad guys. That's sort of the emotions that they engage. What they're sort of doing by doing that is sort of ignoring any kind of like, real criticism. So oftentimes there are different kinds of critical videos on the internet. Some are very well sourced, well cited, kind of offer balanced perspectives. And hate farmers usually won't have that, right? So they'll usually have some kind of narrative where they sort of will find a bunch of information on the internet. And this is where like it's challenging as a content creator because, we've probably streamed for well over 1,000 hours. And if you go through all of the content that we've done, you can stitch together basically whatever kind of narrative you want to. So a really good example of this, if y'all haven't seen it, is Dr.K interviews Dr.K, which is when someone takes clips of me and like stitches them together as if I'm having a conversation. So you can sort of clip things into context to weave whatever kind of narrative you want to. So the first thing to understand about hate farmers is that they work primarily on an emotional level and will really sort of encourage you to get your pitchforks out. They may make some kind of narrative.
So, yes, farming... Like, this is something I've talked about on stream a lot. Farming outrage online is a very real big problem. But complaining about this when you're the target of what he himself admitted can be valid criticism that's very well researched, etc., etc. I feel like you have to. Maybe I'm wrong. Maybe the day I'll be put in the same situation, I'll like cry about the haters and whatnot. But looking at it from the outside, it does feel like you kind of have to, like, you kind of should just take the moral high ground here, where you kind of should just be like, this is me addressing the criticism. This is what I say, blah, 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 and end it at that. It kind of feels like he's crying, boo-hoo, I'm being targeted by a hate campaign, which maybe kind of is the case. Like you guys were talking about how MrGirl seems to really have a hate boner against him. I don't know. It's I feel like it just weakens the tone of the video. There is a problem with doing acupuncture and such. Even if it helps you, it makes you more likely to forego actual medicine. Oh, so I've heard about that. That counter argument for like alternative medicines and pseudoscience. I think that is a fair counter argument, but I would argue that in that case you should but that doesn't discount the fact that you can practice acupuncture and you can have acupuncture be practiced on you in a responsible way. It's one of those things where you would have to prove that there's you would kind of have to prove that there is a very, very real engaging harm in the practice. rather than some people using it wrongly. And even then, like, it's all a question of degrees. There are certain harmful practices that we allow in society because we want people to be free to do them, and others that we don't want to. It's not always rational. Typically with drugs, for example, certain things are allowed, so the other things aren't allowed in ways that, when we look at the quantifiable, measurable characteristics, don't seem very rational. But that being said, I struggle to look at acupuncture and be like, wow, this is like people doing acupuncture and then being anti-vax or anti-medication is like the problem right now, if you get what I mean. But like, not to discount your argument, but more like, you can be an acupuncturist, and if someone comes to you and is like, I have cancer, be like, dude, I'm not the doctor you should be seeing. You should go see a fucking oncologist. You're in the wrong place right now. I'll do the acupuncture and help you feel better, but first thing you do, go fucking see an oncologist. You know what I mean? Anyways. To clarify, he said Reckful was taking what an average person would do to trip on a daily basis throughout the day. Oh, also, wait, something I just remembered, to give context, the idea of taking a psychedelic dose of mushrooms every day, mushroom psilocybin tolerance goes down only after 48 hours, if I recall correctly. Let me double check, just so I'm sure. Psilocybin tolerance duration. I actually ran into that when I was a dumb like young adult in Amsterdam with my friends, and we took mushrooms, and then the next day we took mushrooms again, and they did fuck all the next day. It was one of the times I was the most high in my life the first day, and the next day it didn't fucking do anything. You said Amsterdam? Hey, Chinchilla. Like the psilocybin tolerance is no joke. It's really, really strong. Oh yeah, tolerance. Tolerance to psilocybin builds and dissipates quickly. Ingesting psilocybin more than about once a week can lead to diminished effects. Tolerance dissipates after a few days. Yeah, that's the one. It dissipates after a few days. So actually, if Reckful is taking 2 grams every day, it's not at all the same as any one of us taking 2 grams once. Just to give context to the discussion. Also, I'm being annoying. I'm pretty sure it's pronounced psilocybin. All right, let's solve that, because I'm fucking terrible with pronunciations. Champ?
Run experiments on students with psilocybin mushrooms and
Psilocybin.
LSD.
So Nixon passed the Controlled Substances Act in 1970, and that listed psilocybin and
Psilocybin. Okay. 2 grams a day, lol. Yeah. Reckful was complaining that he wasn't getting the same effect from it and was increasing how much he was taking. Okay, yeah. You can't. I swear to God, you cannot fight psilocybin tolerance. You just if you're microdosing, that's another thing, because you're not even trying to get high. You shouldn't be getting high if you're microdosing. But like what we're talking about here is, yeah, he was doing some weird shit. Oh, sorry, I misunderstood. I thought Sensei was talking about Destiny himself in taking some shrooms, which he did openly talk about, and he said he understood what actual depression feels like after taking it. That's a weird statement, but there are things where I love Destiny, but the Destiny about drugs, I don't know. It's I tended to like stop watching him when he started to go on drug rants, but some of the stuff he was saying was weird. from what I recall. I don't recall exactly what, so don't clip this and send it to him and put me on the spot, okay? But I'm not. Anyways, let's move on. Yeah, I believe MrGirl and the other criticism tubers would have benefited more if their motivation was improvement and not hate/rage. Possibly, but this is a big problem with the engagement meta of social media. This is something we've talked about on stream when, especially in response to the Facebook whistleblowers. There is a very real incentive in social media, in the influence game, for hate and rage. Outrage creates the best engagement. Just look at my YouTube channel. My best video on my YouTube channel is my most hated video right now. It's literally because it causes engagement. I have a bunch of people in the comments being like shitting on me. Outrage porn is what works. There's a perverse incentive in this world of Twitch, YouTube, etc. to create the most outrage possible. And like, once again, it's fair to criticize that, and it's fair for someone like Dr.K to bring it up. It just feels weird for him to bring it up in the midst of his own criticism, when I don't know if it really serves his image in this story, is all I was saying. Yeah, Destiny tried mushrooms once, I believe, or once a year. Yeah, and apparently he had ego death, if I understand correctly, and I don't know, whatever. Sigma. Okay. Reckful has complained that, yeah, I read that already. Exactly, these are alternative therapists should be forced to do what you just said and refer the cancer patient to medical treatment, but at this point they can just keep exploiting the patient's misery. But what I was saying, like, there's nothing wrong with getting acupuncture if you're a cancer patient, either, you know? Shrooms saved my life, man. Good. TBH, Reckful was doing it for 2 years, 2 grams a day. It wasn't microdosing. I know. Double or triple your dosage every day, and it's like you have no tolerance. Yeah, dude, you would. That would be fucking horrible. Also, I'm not saying they should be illegal, but definitely not paid for by the socialized healthcare system, which at this moment in Germany is the case, and I hate it. In an ideal world, honestly, I wouldn't hate some small amount of like massage or massage therapy or acupuncture or whatever to be included in stuff like socialized healthcare. Simply on the principle that it's stuff that improves your well-being, and your well-being is, as a concept, is more of a holistic concept of feeling good in your body, treating yourself, etc., etc. But that's like a whole other fucking debate. Let's not get derailed. Let's get back to the video. But is engagement the same as success in the world of social media? Yes, sadly. Yeah, it might also be the reason why healthygamer.gg isn't directly interacting with them to attempt not to fall for incentivizing them, although not successfully. Yeah, but in that case, he probably shouldn't be making this video, or he should make a much shorter video, being like really to the point. I don't know.
Argument, which sounds very logical at the time, but this is where oftentimes what hate farmers do will come up with a priori arguments. And what does that mean? And that means that the judgment actually precedes the collection of evidence. So I'll go into a little bit more detail there. So oftentimes, if you look at people who are critical and people who are hate farmers, they sort of assume guilt at the very beginning, right? So they haven't really done an objective investigation. Something has happened, and they've sort of decided that you're guilty. And then something really tricky happens, is that once they've decided your guilt, they'll start collecting information. The problem is that on the internet, search and the way that you collect information is going to probably reinforce your biases. So I'll give you a simple example of this. If I believe that the Earth is flat, and I, let's say, do a Google search for, evidence that the Earth is not round, what I'm going to find is a bunch of evidence that actually already supports my conclusion. So you'll even see this with particular hate farmers. Well, they'll do things like they'll tweet out or they'll make public calls stating a particular direction. So they'll say, like, I'm going to make a video about X, Y, or Z and how, let's say, this person is taking advantage of people. And so what kind of response do you think that person is going to get? When I put a call out on Twitter or when I do a Google search in a particular direction, is COVID a hoax? What kind of response do you think I'm going to get? If I tweet out about saying, hey,
So this is a fair counter argument in general. No, not sand. Too late. This is a sand run. This is a fair argument from Dr. K. That sand spirit is going to kill you, really? Is it that scary? Anyways, if we'd optimize for that, we'd have 1,000 things to cover first before covering fucking acupuncture. Yeah, for sure. Yeah, I could see your point, but Dr. K has a knack for responding to his criticisms as soon as possible. He's very active to his Reddit when somebody criticized him, almost the same way MrGirl did. Okay, that's right. To be fair, sometimes you feel that something is wrong with someone's argumentation, but you don't have the tools or the knowledge what it is exactly. Yes, that happens as well. And that makes it hard to address it.
I'm doing a video about, unreported side effects and bad consequences of getting COVID-19 vaccinations. What kind of information do you think that person is going to receive? So what hate farmers do is they come up with a conclusion and then they start collecting evidence, right? And I'm not so sure that they're doing this like insidiously and on purpose. Is it harmful? Absolutely. But I think that they sort of stumble upon some idea and then it actually shapes the questions that they ask. And once you shape the questions that you ask, you're going to shape the responses that you get. And this is precisely why if we look at a scientific standard of how to collect information, making Twitter posts is like not a good way to collect information.
What? That's not... What? All my research is on Twitter. No! What am I gonna do now?
So if you submit a study to the IRB that has a loaded question in it, the IRB, the Institutional Review Board, will say, this is a bad question. You cannot ask this question because it is biased by its nature. So this is where in scientific research, like we understand this stuff really well. When we formulate questions, when you ask a research question, it has to be approved by someone who sort of makes sure that it isn't biased. But when it comes to hate farmers, like they don't go to independent review boards to see if their question is biased in some way. And so then what happens is you create a...
I independently reviewed Chinchilla's mom, and I can confirm she has a bias towards me. Got him. It is a capital mistake to theorize before one has data. Insensibly, one begins to twist facts to suit theories instead of theories to suit facts. Sherlock Holmes. Absolutely, yes. What next thing he's gonna say, watching 10 minutes PragerU vids is not university. Yeah. And hey, we're sitting here saying that talking to Dr. K about your emotions is not therapy, so,
selection bias for information, right? So if I make a post, let's say I tweet something out and I tweet out that all men are assholes. I'm making a video about it. Message me if you have any information about this. I'm going to get a volume of response that agrees with what I say.
Squad W.
Thing is you could do the opposite. You could say all women are assholes, and I'll get the same thing.
True.
Right? So I'll get a bunch of people who hate women who kind of respond to me. And this is the tricky thing, is that oftentimes what hate farmers will do is that based on that response, they'll filter it, right? So this is where a cognitive bias kind of steps in, where even if you call for a particular kind of information, you're going to get the majority of what you're looking for anyway, because it's the internet and there's like an infinite amount of opinions. You'll also sort of occasionally find people like experts. And so this is really important to understand. A collection, like stringing together a group of expert opinions, does not actually constitute evidence. So let's remember that tobacco industries were able to find dozens of physicians who under oath swore that cigarettes did not cause lung cancer. Let's remember that there are anti-COVID information dissemination platforms out there that find medical doctors who say that vaccination is a mistake. Stringing together a couple of experts, which is what hate farmers will do, right? So they'll give you the appearance of evidence. And the way that they'll do that is find a couple of credentialed people who agree with them. But they're not going to include people in the video who disagree with them, right? That's just not part of the narrative that they weave. And so what ends up happening in that the tools that hate farmers use is they'll sort of start with kind of some...
So he talked about it as well. A little bit, which is true. I knew Dr. K was a Giga Chat, yeah. Which is also true. It's you can most definitely criticize the fact that there will be a fundamental research bias in the in what's in the research done against him by someone like MrGirl. Like we've talked about earlier, that MrGirl has kind of has a hate boner against him, all that stuff. Like MrGirl will focus on the parts that are negative towards Dr. K, and something that I was wondering as well, because on my own end, when I was looking into videos critical of Dr. K, I actually had one of my chatters reach out to his mom. And she watched one of those videos, and his mom in question is a psychiatrist or therapist, I don't remember, and she agreed with the criticism of the video. She found Dr. K's behavior very unprofessional. I wonder how much, and like I still I reached out to his mom as well. Nice. And this is not to say that I don't. You true late turn. Chinchilla already made the same joke. This is not to say that this is not a defense of Dr. K either. But this is just something that we have to keep in mind when looking at those extremely critical videos. Is that we see edits on the one hand of the parts that show Dr. K in the worst light. And on the other hand, we also see people who are judging him when MrGirl brings on mental health professionals, for example, to give their opinion. Are they people who actually looked through the entire sessions, or are they people who just looked through what MrGirl showed them, and then were like, "Oh yeah, this looks really bad." So like going back to the testimonial of my chatter's mom. Did she only looked at a video that was already critical of Dr. K. So this is not to say that the criticism isn't valid, but this is also why we're watching this video. We are trying to kind of get both sides and understand what nuances there are in this discussion to be had, instead of just only buying one version of events. I'm buying, that's kind of like a French idiom. Only believe in one version of events. If you only edit the worst parts, it doesn't give an accurate portrayal of what the majority of the interviews are, or what they are like generally. Yeah.
Clickbaity stuff, right? And then they'll engage your emotions, and then they'll, based on their selection bias, will collect a bunch of information, and then they'll string that information together. And it sort of makes sense, right? Because if I make a tweet about, oh, I'm trying to figure out why the moon landing was a hoax, and I'll get 50 people to respond to me, and then when I make a video about it, I'll take the 10 strongest people and I'll stitch them together. And now what I've done over a 1-hour YouTube video is I've made a very strong case for a particular thing. But this is why I remind you that, especially when it comes to some of the criticism that we've faced, it's not a matter of opinion. It's a matter of law, right? These things are very clearly designated, and we are in compliance with these kinds of things. So when it comes to hate farming, be a little bit careful about this stuff, right? Because this is happening more and more on the internet. And oddly enough, I don't even necessarily blame these people, because I don't know that the people who make hateful videos have done any kind of training with like how to formulate a good non-biased research question. That's something that, I learned through 4 years of getting a master's in public health and some amount of as an MD. Generally speaking, formulating research questions is actually like a very technical and difficult thing to do. So I think what's happening is people will sort of come to an a priori conclusion. They already decide that something is bad, and then they'll sort of ask questions in a way that reinforces their bias. This is why the internet is turning into echo chambers, and this is what's leading to toxicity.
No, this is not why the internet is turning into echo chambers. The internet is turning into echo chambers partly because of the confirmation bias issues that Dr. K is bringing up, but also because the algorithms themselves are built around reinforcing those confirmation biases. I talked about engagement earlier, being the reason why outrage is what's most profitable for someone making videos on YouTube, streaming on Twitch, anything to do with social media. Outrage works because of the engagement algorithms, and the engagement algorithms themselves encourage echo chambers. You see that in how Google searches adapt themselves for an individual's preferences. You see that in how ads and content feeds become curated towards your interests on platforms like Twitter or Facebook. This is a much more complex problem. Dr. K is reducing it to one aspect of it, which is not even the most important aspect of it, in my opinion. Even platforms are built around being echo chambers. Yeah, like look at Reddit. Reddit is literally, every subreddit is literally an echo chamber.
The last thing that I want to talk a little bit about is that, unfortunately, recently we've been the recipient of some hate farming. This
He
is
admitted to be a weeb.
Kind of close to home. And
Cancel
one of the things
him.
that really bothers me about these hate farmers is not necessarily the personal attacks, but their decision to include Reckful in these videos. And what actually really kind of pisses me off, to be honest, is not even that they included Reckful, but the picture that they paint of him. What really bothers me is that in order to attack me, what they've managed to do is they spin this narrative about Reckful as like someone who is like easily manipulated and like couldn't kind of think for himself and stuff like that. And that's actually what bothers me the most, is that in order to attack me, they're actually like portraying a picture of Byron that is completely inaccurate. If you knew Byron, which I did, and he was a very close friend of mine, like the dude was brilliant, right? Like he was incredibly independent. He was fierce with his views. He was fierce with like, advocating for himself. He was strong. He was a force to be reckoned with. And he was an absolute hero of the internet. And so what really bothers me the most is like the way that they're portraying him is like some kind of like, weak victim. Like Byron was an absolute beast, right? Reckful Gladiator was an absolute beast. On stream, he brought so many people together. How was he able to do that? It's because he was so damn smart and he was so critical with his thinking and he was so open about his struggles, right? He inspired so many people to get mental health treatment. And what sort of bothers me the most is that in all of this discussion of Byron, no one is sort of talking about what Byron did for us, right? Because the truth is he did a ton for us. And I don't just mean me, I don't mean HG. What I mean is like the internet, the Twitch community, the gaming community. And so this is where I want to talk a little bit about sort of ending things almost on a personal note, because like the way that our relationship has been misconstrued is very like hurtful. And the truth of the matter is that Byron and I never entered into a doctor-patient relationship, right? We were friends. We were professional.
Never mind, you dead. Wait, what? No, I blasted him. How boomer politics is all on Facebook and Twitch left-wing bias, YouTube and their former right-wing rabbit holes, yeah. An interesting TEDx talk from Eric Bischoff about the media using pro-wrestling tactics to keep audience engaged. Oh, that sounds interesting, yeah. Audiences are so fed up with scripted reality TV drama, we consciously find actual drama with real people, as real as possible at least. We watching conflict while being avoidant of it in our own. We love watching conflict while being avoidant of it in our own life. Yeah, it's a Schadenfreude, right? I don't know if you know that expression, but he calls him a really close friend of his. They spoke about 10 times in total. Come on. I think it's fair to assume that they spoke a lot more often. At least they spoke more in private. More than 10 times. I don't know how much, but I think it's fair to assume that they spoke in private as well. They didn't just stream their discussions. And at least emotionally speaking, Dr. K has said stuff like I don't know if I don't remember if it was something Dr. K said outside of his discussions with Reckful or if it was during a discussion with Reckful. They did stuff like planning trips to Japan together, or that moment where Dr. K made the mistake of promising to be with Reckful for 2 years, stuff like that. Those are things that show that they're, whether it was deep or not, there definitely was an emotional investment in there. Title is Why the News Media is Stealing from the Pro Wrestling Playbook. Eric Bischoff. Okay. I don't know if I can stream TEDx talks on because YouTube is really, really bitchy about about streaming copyrighted content live, but I can try and see if my stream gets flagged or not. Anyways, concerning what Dr. K is saying here, I don't know. I want to rewind a little bit. I'm sorry, but I want to. Your words on Byron. I want to re-listen to this.
The last thing that I want to talk a little bit about is that unfortunately recently we've been the recipient of some hate farming. This is hit close to home. And one of the things that really bothers me about these hate farmers is not necessarily the personal attacks, but their decision to include Reckful in these videos. And what actually really kind of pisses me off, to be honest, is not even that they included Reckful, but the picture that they paint of him. What really bothers me is that in order to attack me, what they've managed to do is they spin this narrative about Reckful as like someone who is like easily manipulated and like couldn't kind of think for himself and stuff like that. And that's actually what bothers me the most, is that in order to attack me, they're actually like portraying a picture of Byron that is completely inaccurate. If you knew Byron, which I did, and he was a very close friend of mine, like, the dude was brilliant, right? Like, he was incredibly independent. He was fierce with his views. He was fierce with, like, you know, advocating for himself. He was strong. He was a force to be reckoned with. And he was an absolute hero of the internet. And so what really bothers me the most is, like, the way that they're portraying him as, like, some kind of, like, you know, weak victim. Like, Byron was an absolute beast, right? Reckful Gladiator was an absolute beast. On stream, he brought so many people together. How was he able to do that? It's because he was so damn smart, and he was so critical with his thinking, and he was so open about his struggles, right? He inspired so many people to get mental health treatment. And what sort of bothers me the most is that in all of this discussion of Byron, no one is sort of talking about what Byron did for us, right? Because the truth is he did a ton for us. And I don't just mean me, I don't mean HG. What I mean is like the internet, the Twitch community, the gaming community. And so this is where I want to talk a little bit about sort of ending things almost on a personal.
I have to think about what you just said. So this directly addresses a concern I've seen people have concerning the relationship between Byron and Dr. K, which is the idea, which is not a false idea in and of itself. The idea that when you are in any kind of distress, in a mentally unstable situation, you might not be making the best decisions. Okay, I'm back. Sorry, I was dropping frames for a second there. So this argument that I've heard that I feel like Dr. K is trying to address here is this idea that is this idea that I've seen people believe that you cannot be Reckful was not making the right decisions because he was in an unstable mental state. And you can be both brilliant. You can be both a brilliant and powerful person mentally and still not make the right decisions and still be mentally unstable. I don't know what to think of what Dr. K says here. I understand the sentiment of not wanting to infantilize Byron, and I appreciate that. But I don't know if that's enough to discount the idea that people who are in very precarious mental health situations might truly have trouble making the best decisions for themselves. That's a rough one. I'm not like convinced by what he's saying. I kind of want to play his game Everland, but sadly it didn't surface. Yeah. One of my biggest problems with MrGirl's criticism is the insinuation that people don't understand what therapists are doing. Is that an insinuation? And I've only watched the video Dr. K recklessness. That's the only video I've watched from MrGirl. So and that video he like barely does any commentary. He doesn't say anything to that effect. I guess I'm not very familiar with MrGirl in general, so maybe if I watch like the Destiny podcast thing, then I'll see a bit more what his stance is. I'm not very familiar with Reckful and his community, but when I saw his game, I became aware that he's a genius in his own right. Yeah, the game looks really cool. Like kind of it looked like a kind of it reminded me a bit of the graphics, at least reminded me a bit of like Dofus or some other games in that style. Anyways, continuing.
Personal note, because like the way that our relationship has been misconstrued is very like hurtful. And the truth of the matter is that Byron and I never entered into a doctor-patient relationship, right? We were friends. We were professional colleagues. We were both streamers. That's the nature of our relationship. And one of the things that I've really come to appreciate is that as a professional streamer, I have a responsibility as a content creator. And what we try to do at HG is use our platform for good. And the term AoE healing actually came from Byron. He was the first person who said, it sounds like what y'all are doing is AoE healing. And that's what we're really about. Because the World Health Organization, the US Surgeon General, the United Nations, and all y'all out there already know that mental health is in crisis. That clinical medicine cannot keep up with the rate of like what we're dealing with. That some of the challenges that we face in mental health are even not clinical in nature. Finding purpose in life, developing confidence, learning how to form healthy relationships, learning how to meditate. There is a lot more to mental health than mental illness. And that is what we want to use our platform for. That is why we're incredibly grateful to Byron for the contributions that he made and like the way that he helped us do that. We're also incredibly grateful to our community for supporting us in this mission.
It's something he's personally angry about, I feel. I can understand, but the argument of Dr. K's argument doesn't hold up. Because if Reckful is a smart, critical person, he would also be inclined to listen to experts of a field, like how scientists generally respect other scientists. Are you referring to the fact that Dr. K had almost a phobia of mental health due to his experiences with like being interned and stuff like that? Not I don't know if a phobia is not the right term, but you know, he had a distrust. He had a deep-seated distrust of mental health professionals because of his negative experiences with them. Why do you attribute right-wing to YouTube and left-wing to Twitch? In general, right-wing influencers have had a huge success on YouTube, much bigger than left-wing influencers, and on Twitch it's kind of the opposite. Like Hassan is one of the biggest Twitch streamers, and he's obviously like left-wing. He has talked to other people about it. Another good contentious interview is his interview with Not So Erudite. She's a psychotherapist in training. Sensei, when you say he, you're talking about MrGirl, right? Yeah, Dr. K is not at fault for his death, but he's responsible for his questionable actions during the period that he's still figuring out, where he was still figuring out what Healthy Gamer GG should be doing on stream. Yeah, I agree with that. I believe that is accurate. She's getting into the mental health field, but she has a problem with ethics boards making too large a correction based on the situation because of online pressure. I don't know. I don't know if the online pressure will actually matter. But that's an interesting opinion. Any studies that concluded that? I struggled to find any sort of political breakdown of YouTube users. That is the only study I can think of was the study that looked at connections between YouTubers. YouTube connection, right wing. I don't remember what that study was, but there was like an in-depth one looking at the connections between YouTubers. Anyways, it's a nothing burger, but the advice Dr. K gives is also featured in this. Developing self-confidence, making friends. It's advice from an alcohol and drugs pamphlet. Wait, what? What is this? Are you sure? Are you sure this is the? This is a music video. Are you sure it has the wrong link? Oh, right link, but yeah, the MCA. Okay. Anyways, sorry, back to the video. Nope, is correct. Okay.
The reason that I did this, because I am a medical doctor and I walked away from the majority of clinical practice, is because what I saw at home in my office was the same problem over and over and over again, and more requests than I could possibly deal with. Hundreds of thousands or thousands of people reaching out to me asking me for help, and there's no way that I can get to them. So as a content creator, and this is for all the other content creators out there, I encourage y'all to think very carefully about how can we use this platform, because there is so much toxicity on the internet. There is so much hate farming going on. People are forming echo chambers. Misogyny and misandry are at all times high. People hate men on a level that they never have before. People hate women on a level that they never have before. The amount of hatred on the internet is reaching epidemic proportions. Social media is wreaking havoc on our mental health. We have a generation of people who can't leave their house because of gaming and watching YouTube and all this kind of stuff. And so at the end of the day, as content creators, we have a responsibility to use the tools of the internet to make the world a better place. And that's what we're here to do at HG. The thing is, we cannot do it alone. And this is exactly why we need your help, your participation, your feedback to help us in this mission, because there's no way that we can fix this problem on our own. We're going to do our level best to try. We're going to do it in as ethical and responsible of a manner as we can possibly do it. We've adhered to state guidelines, federal guidelines, standards of practice from the American Psychiatric Association, the American Medical Association, and we're going to continue to do the work that we need to do. And I'm asking all of y'all for help in terms of doing this, right? So whether it's meditating for yourself or being compassionate towards someone else, trying to understand someone else's problems, not jumping to judgment, not giving into toxicity, the only way we can fix mental health and the problems that the world faces is together. So it comes down to AOE healing, and thank you very much for watching the video and participating in what we're doing.
Okay. Is 4 hours long. Not sure if you want to watch it fully on stream. MrGirl discussion with not so erudite. Yeah, maybe. I'm down to watch it, but maybe not like specifically right now. Let's plop down this village, and let's put down sand dunes. I have a specific plan here. It's gonna be dank as fuck. It's each loop, so I can actually finish my loop without fear here. Because I'm gonna grab the blissful ignorance trait. So I'm gonna have a bunch of oblivions. I'm gonna be able to nuke the ziggurat, maybe spawn another one. Even the OK stolen from Destiny. Yeah, do my homework for me? No. Not right now. Maybe when I do a programming stream. Okay, let me catch up on chat. Yeah, the right-wing rabbit hole had a whole study about it. Yes, I remember that. Yeah, that's the study I was thinking about. How people are being redirected towards like Ben Shapiro vids from watching PewDiePie vids. And then they get the Jordan Peterson, Richard Spencer, all those guys, yeah. They kind of corrected the algorithm after that, however. Okay. Alright, this is 4 hours long, and you don't watch fully on stream. By the way, the sequence of events is Dr.K reckless, not so erudite versus MrGirl, Destiny versus not so erudite, Dr.K response, Destiny, Dan, Avi, MrGirl podcast. Okay. Just look at the Twitch politics section. Literally the only big right-wingers are CTV and LTCR fan, and the dude has like 100 viewers on average. Yeah, Magic Shirl is right. You wouldn't look at the just at the politics section on Twitch. Most political Twitch streamers, once they're bigger than 100 viewers, they only stream in just chatting. They just don't stream in the politics section. Reckless came after Not So Erudite, came after Interview. Okay. So I think. Oh yeah, let's look at the other one then. The Destiny MrGirl one. Hear a bit what you guys were talking about. Destiny MrGirl, then